What happens to your mind, body, and relationship when you masturbate too much? Understanding limits, impact, and healthy balance. Before we dive in, don't forget to hit that like button, share this video, subscribe for more content, and comment below your thoughts or experiences about masturbation and relationships. Your voice matters. Introduction: How much masturbation is too much? A number no one can agree on. Did you know that what counts as too much masturbation varies wildly, from once a year to multiple times a day? And surprisingly, there's no universal magic number that defines problematic masturbation. So how do clinicians and sex therapists decide when masturbation becomes an issue? This question sparks debate among many. Some people feel guilty masturbating once a month, while others have no problem masturbating several times a day without it affecting their lives. So what really matters, the frequency or the impact it has on your well-being? 1. The myth of the magic number. Why frequency alone doesn't tell the whole story. Question: Can you masturbate too much, or is it all in your mind? Clinically, the frequency of masturbation alone is a poor indicator of whether it's problematic. A person who masturbates once a year might feel out of control if they believe it's morally wrong or dirty. Conversely, someone masturbating twice daily might feel completely normal and have no distress. Scientific research backs this up. A 2017 study published in the Journal of Sexual Medicine found that the subjective distress and impact on daily life were far more important criteria than frequency alone in diagnosing compulsive sexual behavior. The DSM-5 Diagnostic and Statistical Manual of Mental Disorders also highlights distress and dysfunction over mere frequency. From a psychological standpoint, masturbation only becomes a problem if it causes distress, interferes with daily life, or harms relationships. Personal insight. When I talk with people about masturbation, I find it crucial to emphasize this. It's not about how many times you masturbate. It's about how you feel about it and how it affects your life. If you feel shame or guilt or it's causing conflict, those are signals to pay attention to. Quick engagement reminder: if you've ever felt conflicted about how often you masturbate, hit like and share this video. Comment below what your biggest question about masturbation is. We might cover it in future videos. 2. Masturbation and relationships. When does solo sexuality cause conflict? Shocking statistic: up to 50% of couples report conflict related to masturbation habits. Many people assume that once you're in a committed relationship, masturbation should stop. But is this realistic or healthy? What happens when one partner masturbates regularly and the other sees it as betrayal? The context matters more than frequency. Therapists often see couples where one partner masturbates daily, which in itself is not unusual or problematic. The conflict arises when one partner has strong negative beliefs about masturbation in relationships. Maybe they see it as cheating or feel insecure. This is a classic example of a desire discrepancy in relationships, where partners have conflicting needs or beliefs about sexual behaviors. Scientific evidence. A 2019 study in Archives of Sexual Behavior found that couples who openly communicate about masturbation and solo sexuality report higher relationship satisfaction. Secrecy and shame fuel mistrust and conflict. Practical example. Imagine a husband who masturbates to relieve stress, but his wife believes masturbation means he's not satisfied with her. This can cause resentment unless addressed openly. How to navigate this? Normalize masturbation as a healthy part of sexuality, even within monogamous relationships. Recognize that solo sexuality is not a threat, but an expression of individual sexual needs. Couples therapy can help negotiate boundaries and open honest dialogue. Find compromises, for example, masturbating with erotic material that the partner is comfortable with, or scheduling intimate time together. Personal advice. If you're entering a serious relationship or marriage, have an honest talk about masturbation habits early on. It prevents surprises and feelings of betrayal later. 3. Is masturbation physically harmful? Debunking common myths. Question: Can masturbation actually bend your penis or damage sperm count? This is a question I hear often from patients and viewers. Let's examine it scientifically. Does masturbation bend your penis? Scientific insight. Conditions like Peyronie's disease cause penile curvature but are linked to fibrous scar tissue from injury, not masturbation alone. Repetitive aggressive masturbation could potentially cause microtrauma, but penises are naturally curved in most men by up to 15 degrees, which is normal. Urologists say genetics and injury play a larger role than masturbation frequency. Does masturbation reduce sperm count or quality? Masturbation temporarily lowers sperm count in an ejaculate but usually rebounds quickly. For men trying to conceive, abstaining 2-3 days before collection optimizes sperm quality. Prolonged abstinence beyond 5 days may increase sperm DNA fragmentation, negatively affecting fertility. Daily or every other day ejaculation is generally safe and may even improve sperm quality. Scientific reference. A 2016 study in fertility and sterility highlights the balance between sperm quantity and quality relative to ejaculation frequency. If you're learning something new about masturbation and health, please hit like, share with friends who might benefit, and subscribe for future evidence-based videos. Your support helps spread accurate knowledge. 4. Edging and masturbation techniques, healthy or harmful? What is edging? Edging is the practice of stimulating yourself near orgasm, then stopping before climax, often repeated to prolong sexual pleasure. Question: is edging for days at a time healthy? Short-term edging can be a fun and pleasurable way to enhance sexual experience. Problems arise only if edging interferes with sleep, nutrition, or daily functioning. Extreme cases of prolonged edging sometimes happen with substance use, e.g. methamphetamine binges, but are exceptions. For most, edging is harmless. Edging as therapy for premature ejaculation. The stop-start technique, a behavioral intervention, is based on controlled edging. Studies show it helps men delay ejaculation and improve sexual satisfaction. Teaching control over arousal levels is key. Engage with us, like, comment if you've tried edging, and subscribe for more sexual health tips based on science and clinical experience. 5. How to masturbate optimally, tailoring solo sex for you and your partner. Question: can your masturbation habits interfere with partnered sex? Masturbation is often your first sexual experience and your first partner in discovering what feels good. Problems arise if your solo masturbation style is very specific and doesn't translate to partnered sex, causing difficulty with orgasm or arousal. This is not masturbation's fault, but a mismatch in stimulation. Therapy insight. Sex therapists encourage exploring varied masturbation techniques. Use lubricants, different grips, or sex toys to diversify stimulation. This retraining helps your body respond to partner touch more easily. It's about merging solo and partnered sexual experiences for the healthiest sex life. Practical example. A patient masturbating face down with a specific hand position might find it hard to orgasm with their partner. Trying new methods can bridge that gap. If you want more tips on improving sexual compatibility, hit like, share, and subscribe. Comment your challenges or questions so we can address them next. 6. Secrecy versus privacy. How masturbation impacts trust in relationships. Shocking fact: secret masturbation can feel like betrayal in some relationships. Privacy means you're open about masturbation, but don't broadcast it every time. Secrecy involves hiding masturbation due to shame or fear, like deleting browser history. Secrecy often causes bigger problems than masturbation itself. Relationship advice. Encourage transparency. Normalize masturbation to reduce shame. Address trust issues if secrecy has caused hurt. Therapy can help rebuild trust when secrecy has been damaging. Don't forget to like if you agree privacy is healthy, share this message, and subscribe to support open conversations about sexuality. Comment your experiences with secrecy or privacy. Conclusion: masturbation is normal, but balance and communication are key. To wrap up, masturbation frequency alone doesn't determine if it's healthy or problematic. The real issues lie in the emotional distress it causes, its impact on your daily life, and how it interacts with your relationships. There's no universal too much, it depends on your values and context. Open communication with partners reduces conflict and shame. Diverse masturbation techniques can improve partnered sex. Secrecy is more harmful than masturbation itself. Science supports masturbation as a normal, healthy part of sexuality. If you're struggling with guilt, relationship conflict, or sexual dysfunction related to masturbation, seeking help from a qualified sex therapist can make a huge difference. Before you go, please like this video if it helped you, share with anyone who needs this message, subscribe for more honest, science-based sexual health content, and comment below what surprised you most or what you want to learn next. Let's end the stigma together.